Welcome to the Vet Dental Show. I'm Brett Beckman, board certified veterinary dentist, and I want to welcome you to the podcast that we do every Wednesday for you as veterinarians and technicians to help you be the best you can be in your general practice in veterinary dentistry. Today, we're going to talk about how to manage a patient that has been evaluated. We've had dental radiographs. We've found an oral mass that extends onto the palate from the fourth premolar that's very proliferative. There's a large mass section of that vestibular-wise that could be excised, and there are two teeth adjacent to that mass, caudal to it, that are associated with periodontal bone loss. So in evaluating this, we have established that this is not a tumor that is going to be resectable with surgery. It will extend too far into vital structures, including the eye. So the owner is opting for radiation therapy. And we've made arrangements to talk to the oncologist on referral. And so we're at that stage where we're about to manage this case and talk to the owner about how we're going to manage this case. So one of the biggest complications of radiation is osteonecrosis, and that occurs in about 15% of patients that receive oral radiation in human medicine. And we're unsure about the incidence in veterinary patients, unfortunately, but we can assume that it's about the same. So with that, if we have teeth that are affected by periodontal disease in that radiation field, guess what? That is going to progress just like it would if we didn't have a tumor or a mass. So we can expect that that's going to be a problem down the road and require extractions. There's a problem with that because irradiated tissue is very, very likely to succumb to osteoradionecrosis, and extractions post-radiation carry a very high rate of dehiscence and associated necrosis just from the procedure itself. So we want to make sure that we prepare these patients before we refer them. The recommendation in humans for this is to extract. If you have teeth that are affected by periodontal disease in the radiation field. So that is exactly how we as veterinarians should be approaching these cases. And it may be that the oncologist does not recommend that to you. I see this, unfortunately, very often in referral where we get patients in that have had radiation and they get necrosis and they've got generalized periodontal disease. And the necrosis may or may not be due directly to that, but the extractions that are required after that are very likely to succumb to those complications of dehiscence and chronic management and morbidity for the patient. So in a situation like the one I just described, number one, we can excise the bulk of the mass on the vestibular side and remove the tumor burden to make radiation more successful. The other thing that we can do is extract the teeth that are in the radiation field, including the tooth that might be affected, the fourth premolar that might have bone involvement, including that as well prior to the radiation procedure. Upon completion of those extractions, the way we want to proceed is to close that flap, make sure it's tension-free, and allow 3 weeks minimum before referral for radiation. Once we've established healing, we can safely send that patient in for radiation, and the likelihood of complications is significantly decreased with extraction of the teeth that are involved there. So managing those from that standpoint will help the patient considerably. And again, this is something that we don't always hear from the radiation oncologist, and something that we need to take our own initiative to in general practice to resolve. Now, that being said, these cases are not easy to manage. There's a lot of moving parts. So if you're not superiorly confident and comfortable in surgical extractions and have had additional training like our wet labs or the veterinary dental practitioner program, then you will not want to attempt to do extractions in these cases. You will want to refer these, because the success of the radiation therapy revolves around the success of the extractions and the healing of those extraction sites prior to referral, the excision of the bulk of the mass. So anything beyond your comfort level, please consider referring these to a dentist for extractions, mass excision closure prior to sending them to radiation. What this might look like after radiation needs to be discussed as well. And this can be with or without teeth involved. And if you've seen oral mucosal bone exposure, that bone is going to be a very roughened surface with a brown discoloration or deep tan discoloration to the bone. And we see this in the maxilla most commonly in dogs where they've had radiation with or without extractions of the adjacent teeth that have had periodontal disease, or the tooth that's involved with the mass. And it will present exactly like that. You've got mucosal healing around this brown spot that is the necrotic bone, and that bone necrosis is going to result in a fistula and needs to be removed and closed. And that is not a procedure that you definitely want to consider in practice. That is something that you want to refer. So if you see this post in your evaluation and it's maybe down the road before the oncologist picks it up, or at an interval where you have not had the recheck with the oncologist, that's something that needs to be considered. Closure at that point is very difficult to predict a good outcome because of the fibrosis of the bone adjacent to it, because of the decrease in cellularity, the decrease in the clarity of the blood supply in the tissue that's been in that radiation field. So we stand to do worse. We stand to make that patient worse. So all that being said, I know this is a lot in a short podcast. All that being said, we need to really look at these patients, evaluate them based on your skill level, evaluate them based on the extent of the mass, the teeth that are involved, and the owner's respect the owner's wishes on how to proceed with this, and do the best you can to manage them based on what I've told you. So I hope you've enjoyed this podcast. I hope it's been effective for you and will get you thinking if you see these masses in practice that can't be surgically resected. And if you are interested in pursuing veterinary dentistry and love it and want to do it and do it solely in your practice, or the majority of the cases that you wish to do in the future are in that category, the Veterinary Dental Practitioner Program is the program for you. And you can put in an application for that at ivdi.org/INV, like invitation. Hope you enjoyed this again. Take care, and we'll see you next week.